Good afternoon, everyone, and thank you so much for a bit of a different day and time for our COVID-19 Financial Oversight Committee meeting. I appreciate you all making the extra time this week. We are obviously via WebEx and need a motion to proceed with our agenda electronically.
I have it. I move that the proposed agenda constitutes essential business and that meeting electronically is necessary to protect the health, safety, and well-being of Tennesseans in light of the COVID-19 outbreak.
Second.
Great. We have a motion to proceed in a second. If there's no discussion, I'll go ahead and take a roll call vote. Sarah Finley?
Aye.
Councilmember Gamble?
Aye.
Edward Henley?
Aye.
Councilmember Johnston?
Aye.
Let's see. Vonda McDaniel?
Aye.
And Councilmember Sepulveda?
Aye.
Let me just double check that we haven't had our other two members. Okay, so thank you all. We are, we have six, right? 1, 2, 3, 4, 5, 6. 6 in favor. We will proceed electronically. You know, our really two primary agenda items for today are to look at our final spending resolution. Our Metro Council is very anxious to see a framework and a plan and what that looks like. At the very end of last meeting, we also had a request to have MNPS join us in case there was any follow-up questions for MNPS with the adjustment to the resolution. So again, just a reminder, what we, the recommendation from our last meeting was that we would proceed with a substitute resolution, which is, it will, just as our previous one that was deferred, it will expand the eligible use of the funds for MNPS, but it reduced them to 19 million from the original that was passed in June, 24 million. So that is what we drafted. We, you know, everybody, you know, voted in favor of. And so that's where we're currently at. So with those two items as our primary agenda, I did want to have Kristen Wilson just talk a little bit about our city priorities and where we're at. We shared a priority kind of framework with you at the last meeting that we'll work off of today also. So Kristen, thank you so much for being here from the mayor's office. I open the floor to you.
Sure. Thanks, Mary Jo. Can you hear me all right? All right. Thank you. I guess, first of all, I want to say thank you to this committee. I've been following you all for a period of time, either attending and watching when I can, or catching up afterwards with Diego, Mary Jo, Ashley, and I can't just say thank you enough for the amount of hours and time that you all have put into this process. It's been thoughtful, it's been very deliberative, and to me it's sort of a sign of ultimately the best of what we can do as a government when in the midst of kind of the challenges that we have before us right now from COVID-19. So first of all, I just wanted to express our appreciation. If you recall, in one of the very first emails that you received back at the very end of July from Mary Jo, we had asked, at least on behalf of the administration and Mayor Cooper, that you all go into this process reflecting on some guiding principles. And the very first guiding principle we had, and it's been what's been our guiding principle for us as an administration since the start of this pandemic, was we will protect our community. Emergency response is our highest priority. And you know, we've been incredibly appreciative that you all validated our estimated direct emergency response operational needs from the very beginning of this process. And now it sort of seems fitting to kind of be coming back around at the end or in some of your final deliberations and reviewing where we're at on that. for us, it still remains the highest priority is to make sure we have funds available for our emergency response. That includes activities such as assessment centers, contact tracing, response lines, our vulnerable population supports and the homeless shelters to mitigate the spread, the public safety and health order enforcement activities we've had underway, PPE, and ultimately vaccine planning and distribution of it, which by all forecasts, even this morning, Dr. Fauci was saying that we may be looking at starting distribution even at the end of December, early January in the healthcare community as a starting point. So we're not through this. We have still weeks and months, certainly months ahead. And our concern is, as we move past the 12/30 deadline, making sure that we have the appropriate resources in place to continue these activities. Two reasons I think about this. First of all is the life health safety one, which is the most important one. As we're going through our surge right now, we have over 4,000 cases active in our community right now. We announced 978 cases today, which is our highest number we've ever announced. Granted, there's some backlog of processing through the state that influenced that number. Yeah, 346 people have died, and it's awful. I don't know really that we spend enough time reflecting on where we are, and I suspect there will be a lot of processing for us as a community in the future and as a country in the future on this. These activities we have underway, whether it's the testing and assessment centers, the contact tracing, the response lines, the health order enforcements, they are what the tools that we have in our toolkit as a community right now to do our best to try to mitigate and stop and keep those numbers as low as they possibly can be. And at the end of the day, this is, again, why it is our highest priority is without some of those resources, without the ability for our community to get tests and get test results in a timely manner, without our ability to move quickly on contact tracing, without our ability to have those response lines active, without pushing, and it breaks my heart that we have to go through some of these enforcement activities, but we have to push our community to make sure that we are using the tools we have to mitigate the spread of this. Without that, our case numbers would be even higher, our death numbers would be even higher. And that's quite frankly what a lot of these activities come down to. Setting aside those fundamental values on life, health, and safety, which I think is, again, in many cases, our primary purpose right now, if you believe our current economic challenges and support needs only get worse if and as the virus works through our community, the best thing we can do from our economic recovery for small businesses and for individual support as well is for us to try to focus on safety in our community. There's been some incredible work, and I'll be happy to send these links to Mary Jo to circulate to you all in the committee, both on a national level by Harvard, by Professor there, Ross Chetty, Opportunity Insights, as well as locally, or I should say at least statewide, with Tennessee data by Vanderbilt, led by Melinda Bunton, that shows that if you just open the economy, it doesn't do anything to help it right now. But if you control the virus, that is what is needed to get people to go out, to feel safe, to spend money, and to get the economy back. And so I just want to emphasize that these are also the tools. Not only do they have the life, health, safety benefit, but in my mind, our assessment centers, our contact tracing, our response lines ultimately are the tools we also need to recover economically at the end of the day. And we as a community, as a city, as an administration, want nothing more than to have this behind us. But while we're still in it, I'm going to continue to ask you all to make this the highest priority overall. In terms of the resourcing, Mary Jo shared with you what we have built up as our budget for what we believe we need to maintain these activities. It does come above the 20 million. It's about 23 million. I think that's already been circulated and distributed. We're happy to answer any questions about those. We do feel confident that based on some of the other avenues that we've been exploring, for example, FEMA reimbursement and otherwise, that if we make this 20 million, we'd have the funds available to make sure we're covered for these needs and for this highest priority. We recognize the need for humanitarian aid and we don't want to stop that. And so if we can still leave some space for that, we wanted to make sure we were taking that into account as well as possible. I'm going to stop there unless, Mary Jo, there's anything else you think I should highlight at the moment, and here to answer questions or to assist in any way as I can as you all think through the next steps here.
Yeah, thank you, Kristen. I didn't have anything else. I just really appreciate you sharing, kind of your thoughts and some of the priorities for the city, as well as I, can help but echo, just appreciate the committee and all the time they've spent on this. So with that, we currently have, because of the change in the resolution for MNPS, I know the framework, the most recent one shows the 24.8 million unallocated, but if we continue with the $19 million resolution for MNPS, we are looking at 29.8 million to spend, and we haven't really been using that word spend as much as we've been saying allocate or reserve. But just a reminder, again, looking at kind of that framework of what we're looking for is what is that final spend number that we are going to spend on our public safety salary, and therefore that amount that we spend on salaries, we will turn around and use that same amount as a reserve. That reserve would then cover the city's emergency response. It could cover additional funding to our nonprofit partners. And then it could also, what we know is, I've teased about this before, they are estimates. I don't have a crystal ball and I know they're not going to be exact. So we are going to have plus or minus in the emergency response. We may have some remaining funds from our nonprofit partners at the end of December 30th. Even in what we allocate from this newly created reserve may have pluses or minuses. And what we want to do is put in the framework what to do with those funds as time proceeds, into that, be it February, March, April, as more information comes available and estimates get trued up to actuals. So the third piece of that structure would be that unspent funds from all of the different estimates that we've made, even if they arrive because of changes in the FEMA reimbursement, that all of those adjustments continue to accumulate in this reserve. And after all of the needs have been met, the remaining funds would be used for infrastructure. And some of these are the ones that you've heard about from the departments. It would allow us to have replenishment for some of our emergency management needs, medical supplies, gear, the fleet. We did hear a lot about our health department, police department, and fire and OEM with some fleet needs and some IT needs from our health department. So remaining funds then would be in that category after we've expended everything that is specifically identified in this final framework. And again, we would continue to have reporting. So I think it's always important to be able to report back to this committee and the council what we have incurred in actuals based on these estimates. So that reporting would continue until the fund is depleted. That is where we are headed today. That is our task at hand. Does anybody have any questions, comments, or want to start us off?
I have a question.
Yeah.
Surprise, surprise. When we're looking at Metro's response needs, and we're obviously making some judgment calls on that, we're estimating. And a lot of, or at least a portion of it, will be to some extent taken care of by FEMA. Is MNPS, because I know that that Clay was concerned mostly about a PPE issue as we move into the latter part of the school year. Hopefully we'll get back to where people feel comfortable in school and all that, we get through this mess. Are they eligible to apply for the PPE through FEMA as well? Because that was part of what they were going to use, this over allocation for.
Yes. So early on, in addition to the $24 million for hotspots and laptops, I did talk to the folks at MNPS, and we did let them know that expenditures that they had that were FEMA eligible, because we are, essentially the same, related entity, that their expenditures can be included in our FEMA claims. So there are expenditures that have been charged to the, what I'll call like the COVID FEMA fund that are being included for reimbursement. Now, I will say one of the challenges is that much like the expenditures that FEMA is or that Metro is claiming for FEMA, the rules at September 15th really clamped down by FEMA for all entities, municipal, city governments, state, municipalities, schools. It really clamped it down to the point of PPE is not as widely reimbursable as we would have thought. And it's getting into particulars of masks for prevention are not reimbursable. Masks for somebody who has COVID from the spread would be.
Okay.
And it's getting really, really sticky. We're working really closely, not only with our own consultants, but they have a team around the country. I participate in weekly calls. So yes, sorry for the long answer to your question. They are eligible, but there are certainly concerns that FEMA is not approving as much as we thought they might.
And Mary Jo, is it still accurate that they end on December 31st?
FEMA does not have a December 31st date.
Okay, thank you.
So the response is ongoing. In fact, there is some current legislation on the floor of the House trying to get FEMA to expand their eligibility guidelines because they clamped it down so tightly. There's been a lot of vocal response back to FEMA to say, this is not what we expect. This is not what we get in a standard response. We need to really, open up some of this eligibility. Sarah Finley, I see your hand.
I just want to expand on that prior question, because what I'm just trying to get my head around is, we talked last week about the fact that some of the funds that had been allocated to MNPS ultimately were sourced somewhere else. So we had on the table a resolution to adjust downward that initial allocation to reflect that. But I also am under this sort of, assumption that given what's happening with COVID right now, that the needs for Metro for emergency response and the needs for MNPS for the impact on learning, the costs are increasing a lot right now and will be likely to increase over the next several months. How do we, in terms of priorities, we've talked about emergency response being the priority. Where does MNPS fit into that in terms of how we should look at it? Is it sort of at the same level as the emergency response? Is it something that comes after the emergency response is paid for? Because I assume it's all coming from, Metro budget allocation, but I'm a little bit confused about how we look at that from a priority standpoint.
I'm happy to speak to that a little bit, Mary Jo, if you'd like. Again, going back to the guiding principles we had used back in the originally, our first one was we will protect our community. Emergency response is our highest priority. Our second one was we will give our youth the tools they need to ensure their education continues. Our third one was we'd promote health and safety for our citizens in need, particularly our vulnerable and our essential workers. And then our last one was we'd reinforce the infrastructure that binds us all together as Nashvillians. So to the degree that, and we think this is important, that our children are in school so that our youth have the tools they need to ensure their education continues. That's where the PPE in particular comes in. And so I'd say it's a very close second priority on this front, because I know several of us on the phone have young kids, and certainly the youngest ones, their education continuing isn't as strong in a remote setting. I think there's been studies about that as they are in person for the youngest. And so I think that's a very close second priority, if that helps.
Yeah, and
appreciate that. I just, we wanted to have MNPS, folks available today to identify if there were any specific needs, but I think it kind of gets back into the safety aspects of things. And so to me, they kind of get wrapped together. So I'm just trying to figure out, when we think in terms of this proposed resolution and laying out what our priorities are, the extent to which there is overlap or not. And that's helpful in terms of, I think you gave us a ranking, even though it's a very close ranking, and it sort of also depends on what the dollars are going toward. But it's, I just wanted a little bit of clarity, and I appreciate that.
So to continue with that thought of clarity, Hank, I don't want to put you on the spot, but I think I thought some of the questions from last week were very much around determining what the need is and the different sources of funding. So perhaps if you could maybe explain something along the lines, if you've got this, more of like, what is the total price tag what has Metro MNPS estimated, the total expenditures, and how are all of those needs being met? And when I say expenditures, I mean, those that have arisen and are related to the COVID pandemic. What is that total amount, and what are the various sources of funding? I think we've been talking very piecemeal, and perhaps a bigger picture might be helpful to the committee.
Thank you, Ms. Wiggins, for that. So again, Hank Clay from Metro Nashville Public Schools. Thank you all for having me back, and I'm happy to convey the needs that our youth, your second priority, have in this situation. So Mary Jo, I don't have the ability to share at the bottom of my screen. Is that something that y'all can provide? You're muted if you're talking.
Yep, sorry, I was muted. Is that something, ITS, that you all can give Hank the ability to share his screen?
Yes, ma'am. 1 second.
Awesome, thank you.
All right. So thank you all for asking this question. I thought I'd put together 3 PowerPoint slides that helps to ground us in what we're talking about. So this is one that you all have seen before about what the original allocation was for. The state allocation updated that to be a little bit more specific of the $10.5 million that we received from the state, or will be hopefully receiving from the state, to help offset those expenses, and then how we're suggesting to reprogram these. So one thing I wanted to clarify is, again, I'm so thankful to Ms. Wiggins and Mr. Robert Fisher, who's on this call as well, and the entire mayor's office and Metro government finance team. We've worked really closely together to develop the strategy around this, to then think about, okay, what are the different pots of money? What are the different limitations for each? And how can we best stack those resources on top of each other to maximize every penny? And so the proposals that we brought to y'all about teacher devices and the student curriculum and supplies were based on exactly that. What could be handled before December 30th, the deadline? And then what could that free up on the MNPS side of things to be able to handle those ongoing expenses throughout the course of the current academic year that we're in. So when thinking about what the total need for education in Nashville, we see that there's about a $26 million gap between the resources currently available and what the true need is. And so what that does is you all are, of course, familiar with our private school colleagues who have opened up. They've shown us what the actual needs are for being able to reopen schools and to operate in this virtual environment. And what we have seen from the private school industry, of course, they're doing just what's needed because the resources are scarce like us, is $1,090 per student. So then we have here in the $60 million, what has been allocated so far to be able to help address that need. So you all have very generously with Metro Council allocated a $24 million to help address needs. There was a $10.6 million that came in through the Tennessee Technology Grant, the connectivity grant that we talked a lot about, and then $125,000 through the reopening grant. And then the education-specific CARES Act of $26 million. As alluded to earlier in the call, we have also tried to work with Metro Finance to leverage every FEMA reimbursement that we can. So we originally had $6 million for the first couple of months of PPE that we needed in our budget. We then moved that over to FEMA. As we've seen those responses come in, thank you, Mary Jo, for updating me that will extend past December 30th. I had not heard that yet. So we're just seeing a lot of that as the virus continues on and on and on. And then the state has provided some resources as well. So that shows you the overall picture. When you think about what is actually needed, it's this long priority list. So we talked about some of it, technology for students, hotspots for students, virtual curriculum for students and supplies for students, and technology for teachers. What you all, by us applying for the state grant, winning it, some of the next items that come at the top of that priority list are the nurses. How can we do the contact tracing in our schools? How can we build confidence? How can we make sure that what we have is needed? So nurses cost about $4 million per year to ensure that there's a nurse for every single school that we have. We work with public health to provide those. They're not MMPS employees, and so we contract with them to do that. Funding for student lunches to make sure that those are maintained, and so that when we pivot back at any point, we will be able to provide meals for students, the PPE for teachers and students, and cleaning supplies and services. So that is a major element, as well as the HVAC systems for our schools, which, to be honest, I don't think that any of the city's resources are going to be able to reach that important item. And then replacements for quarantine staff. So we've seen, hundreds and hundreds of staff who are quarantined. And so how do we provide the services for students when there is a quarantine? So I'd be happy to talk about any of these individually and answer y'all's questions. So thank you.
All right, I've got a couple hands here. Councilmember Johnston?
I'll let Jennifer go. She raised her hand, so I'll let her go and then I'll talk.
Councilwoman Jennifer Gamble speaking. Thank you. I appreciate the explanation of needs, Mr. Clay. That was very helpful in seeing that. My question actually was a follow-up to Ms. Wilson's statement about the 5 priorities, and with number 2 being the safe continued education of our children during this time. Does that, when you mentioned that it includes, of course, the health aspect as it relates to PPE, nurses would be in that as well. Does it also include the continued learning in the virtual space? Because at this point, we're not sure when our students will be able to get back into the classroom. While we should be preparing for that during this time where we're virtual, should there be consideration for that continued learning in that second priority as well? And if so, has that been taken in account? And is it that we should discuss that now? Because I don't see it in the spending recommendation framework. I don't see education in here. So is that something that we should discuss as an addition, or is it not considered, I guess, in that emergency priority?
I'm going to let Kristen talk, but I'm going to interrupt real quick. This is Mary Jo. The only reason it's not on this sheet is that the framework was originally drafted when the MNPS resolution was still at 24 million. So I just wanted to take accountability for the fact that the sheet wasn't updated after we reduced the resolution to 19, which is why it wasn't part of that. And then I'll just let Kristen reply.
Sure. Thanks, Mary Jo. The priority is for us to figure out how to give our youth the tools they need to ensure their education continues. And so out of that, yes, I think it is comprehensive enough, Councilmember Gamble, to contemplate, I think, to your question, the both the remote learning curriculum and curriculum aspects of it. And just to be clear, we certainly as a operation have been doing as much as we can in partnership with MNPS to make sure that they, have whatever support we can provide for that. For example, a lot of our library staff has been involved with some virtual curriculum creation, and as we've diverted resources from kind of our historical operations into new operating models to be responsive to the current needs. And so that's been an important partnership and a valued one. And obviously, yes, of course, our safety of our children in the school settings is primary. And I know the conversations that have gone back and forth between the MNPS administration and the Metro Coronavirus Task Force. There's a very strong bright line that's in place, which is we aren't allowing for our schools and our teachers to as recent as the email from Dr. Battle last night that went out, and perhaps Hank would want to comment on that. We don't want our schools to be in session if we can't feel confident about the safety of the educational experience for our teachers and for the children that are there overall.
Yeah, Ms. Wilson, thank you. I agree. Y'all have been such great partners in all of this, including public health. To put it in perspective, we have currently in session, we'll see where the numbers lead us in the future, but currently in session, we have more schools in session than entire Williamson County School District. So we do have schools in session. They have been in. We started first bringing kids back, our highest needs kids with students with extreme special needs back right after Labor Day. And so we've had essentially dual school systems that we've had to be running. One in person, and then one virtual at the same time, which, as people might guess, just takes a whole lot of resources. And I guess I apologize that we maybe did not bring to y'all all the needs, which either are $26 million currently, or if y'all end up reducing it by $5 million would be more than $31 million in unmet needs, because we want to be great partners. We do know how much pressure there is as a city, and we recognize how hard it is for y'all to decide. But the needs are real. They're tremendous, and happy to talk more about it. So thank you.
Thank you both for that clarification. I just want to make a comment at this point. I think. I don't have my children are out of school, so I don't have children attending schools right now. But I, like most of us, understand that there are needs in the school system that go beyond what we can even imagine. And I just think it sets the wrong statement for us to be reducing the amount of funding for schools so that we can meet that second priority that was described, and making sure that our children have a safe, healthy, and a learning environment, whether it's in the classroom or virtually during this pandemic. And I think it's setting a bad precedent in reducing that funding that the council had already allocated that could address some of these needs that we're discussing today. Thank you.
Councilmember Johnston.
Thank you. So my initial thought process on this was, so we've gotten to the 29.8 million unallocated theoretically, and there's a $23.203 million estimated expenses, not taking into account what FEMA will come up with. Y'all are feeling comfortable with saying we know that or we believe that it's 23, but earmarking 20, we feel is safe when it comes down to, after FEMA, that would be met. My thought process was to say, instead of allocating $20 million to Metro's emergency response, to allocate $25 million to that and specifically add in MNPS to Metro's emergency response, and follow those 5 priorities that Ms. Wilson laid out, where our school system is actually number 2 in priority after health and safety, which I think is appropriate. So I fully expect that to some degree, probably all of that $5 million would go back to the school system. What I'm hoping is that at some point the state may step back in, seeing that there is a greater need of, instead of $26 million of unmet needs to the 31 or whatever the numbers are, that they would say, hey, there's a greater need. We need to support our schools, that the state would come in, that maybe FEMA would lax up on some of their criteria for reimbursements. Maybe federal dollars would come in, seeing the greater need. And if not, that $5 million is still there in Metro's emergency response, and that the remaining 4.8 go to community needs, because which to me is the individual rent, mortgage, utility, and then the small business. We ran through that small business allocation really fast. We're going to run out of the individual support for rent, mortgage, and utilities probably by December 11th. I did speak with United Way today, and some of their community partners, not foreseeing additional allocations, are actually, not to repeat this term, but winding down. So their extra people, resources that they've had to disperse these funds are going to go away unless we communicate to them that, yes, we are going to be allocating more money for this. It does scare me that we're looking at running out of those funds, coming into the harshest part of, as far as weather goes, that people could be put out onto the street, which is certainly not what we want. That to me would be a number 1 priority, keep people in their homes. And then after that, small business, and then anything left over at the end of June 30th, the end of FY21, to go to infrastructure, which I think we all have said is important, but certainly not emergency, like keep people in their homes and taking care of our school system. This by no means to me is taking money away from the schools. That's not how I see that. It's correcting an over allocation for two very specific needs that the first resolution in May delineated. And then at that point, we've got massive need across the county, all the way from individuals to our emergency response. And so to be as thoughtful and prepared, to me, is the better use of funds. Again, putting Metro schools into Metro's emergency response earmarked money and bumping that 20 million to 25 million, to me makes sense. And then, again, hopefully some of these, either FEMA or the state, will come in and see this incredible need and plug in where they can. So anyway, that was my thought process, just trying to use these dollars as responsibly as we possibly can. We've got such a great need, and $121 million is it's just not. It sounds like a lot of money, and it's just not.
Okay, thank you for that. And I think the other thing that accomplishes is it does keep a flexibility, a little bit of, again, going back and forth between estimates and actuals. So taking that note, getting to a few other hands here. Sarah Finley, I think yours was up first, or I should say next.
Yeah, I just have a question for Mr. Clay, which is the numbers that you just showed us, which describe some kind of one-time cost, and then others that would be presumably, recurring on a monthly basis based on, how the pandemic continues. What dates were you using for purposes of those estimates, and where does that actually cover the metro needs? What date does it cover it through?
Those are estimates through the current school year, through May 21.
Okay, so that's helpful. So basically, those numbers would assume sort of a steady state of where we are now through the school year. Is that fair?
It makes a combination of assumptions between this kind of in and out pattern that we seem to find ourselves in.
Okay, that's helpful. Thank you.
We every moment that we can have with our students in school is extremely valuable, and we also won't do that unless it's as a safe environment. So that's kind of our two equal situations that we're trying to work through.
Kind of going back to Courtney's point, I've been sort of struggling since last week with this sense that I know the needs are dire on the education front, and the sense of sort of a takeaway from something that's been allocated is hard to kind of accept. That said, we're trying to figure out the best way to balance a lot of competing priorities. It does seem to me that some concept where we could preserve availability for education without necessarily just keeping the allocation there today, since some of these costs really won't be incurred until after December 28th, makes some sense. What I don't want to have happen, though, is have them get lost, because as a practical matter, the emergency response needs are probably going to eat up whatever goes into this special fund. The education amount is going to be larger, and then the need for rent, utility, and other things is going to be larger in small businesses. Because in the absence of something really drastic changing, we can't count on this status quo of today ending for several months. Vaccines are on their way, but they're not going to be prevalent for quite a long time.
And to add color to what you just shared, Ms. Finley, we, in a normal metro government budget, you all share about 50% of the city's resources with education. Out of this citywide CARES Act, it's 19.8%. So we try really hard not to ask for more than what we need. The needs far outstrip, and so that just helps to put in perspective as well. So thank you.
Councilmember Sepulveda, did you have a comment, question?
I did. Thank you. This is Councilwoman Sepulveda. I was hesitant about this at our last meeting. I mean, for some of the reasons that were already stated. Our schools are already severely underfunded, and we our needs are much more than what we are being asked for right now, and our numbers have continued to go up. It's something that I'm not very comfortable with, especially because we've been waiting on the state to step up for so long, and they haven't. We waited on them to step up on getting more business relief out faster. Some of the businesses still don't know what's going on, right? They still haven't made significant amount of outreach. We waited on them to step up when it came to music venues, not just them, but the federal government. We been waiting on them to step up for, relief for rent and mortgages, and we still haven't seen that. I don't have much faith in this state and our current leadership there, to be able to put my entire faith in that. Maybe they'll step up, and the way that FEMA's going right now, I we're still waiting, and it's just, I think that this money is going to be needed by MNPS anyway. So I'm more in favor of going ahead and doing that. Again, I'll go with whatever the committee decides. I just don't put my faith in our state government at the moment.
Okay, I see one more hand, and then I'm going to, after Councilmember Gamble, I'd like to kind of maybe walk through what I'm hearing and what we could start working on from a framework. Councilmember Gamble.
Thank you. And I'll be brief. And this may be something that we can discuss later, but I wonder if there's another contingency plan that Metro is working on that will address COVID-related needs after December 30th beyond the $24 million that we're discussing today, because we know that there will be needs beyond that. As Councilmember Sepulveda said, we can hope and pray that the state and the federal government gives more relief beyond that date, but not knowing for sure. I just want to know for myself and the viewing public if there are discussions or contingency plans being made for spending beyond this $24 million that may be incurred as the virus continues to move forward.
Yeah, that's a great question, and there is a lot of conversation, and I would say, planning beyond hoping. So just a reminder, there are a couple things that we have kept as a contingency. The largest amount is there is a $10 million grant that was given to us by the state. It back before we started this new fiscal year, the original intention had some criteria that it could be used for. And as the state ended up their final budget, all criteria and restrictions were lifted. The amount was reduced down to $10 million, but it is $10 million that we have very intentionally kept in reserve. It can simply be used for what we need it to be. And until we really see what the expenditures of this virus really create for our city, it does have to be used by June 30th of 2021. So it does need to be used in this fiscal year. It doesn't have an unlimited life, but that $10 million certainly could go far. We had several requests for it under its original criteria. So we're, very aware that it can't solve everything, but we won't make any decisions on some of the infrastructure requests that were associated with that grant until we know about the virus. There was one other, contingency reserve included in our budget, which is approximately $3 million for public health and safety. That was not necessarily specific to COVID. It was in our original budget that was adopted by council in June. And so we're, again, very aware of the fact that, should we have COVID-related expenses that are impacting our public health and safety, there is an additional reserve. So those are tangible, those are real, that we continue to, keep track of as we think about what expenses are potentially going to hit our budget that were not in budget, and how do we cover those. Again, we, will be aggressive with FEMA, but guys, I'm going to tell you, that they are not the knights, coming in to save the day. That is for sure. So, but we continue to work with the state. We continue to work with those that we can at the federal level. There is, discussion with a new administration that we might find out information in January. again, that still forces us to make these decisions today, because there is not a real high level of confidence that something will happen at the federal level before this December 30th date. So what I hear and what I think is something, what I'm hearing is that we have the 29.8 million that currently is not allocated. If we were to direct that spending to our public safety salaries, what that would do is free those funds up to create our new reserve. That number is $5 million more than what we discussed, but what I hear is a continued desire to make sure that MNPS and our educational needs are met. So if we incorporate that $5 million into the emergency response, that makes our emergency response number 25 million. The other thing that it does is if we don't get the extended eligibility that we're hoping for with FEMA, some of those basic PPE needs that MNPS has that would not be eligible can now be funded with those funds. The 5 million that we essentially preserve for MNPS included in the emergency response becomes more flexible. It extends beyond the 12/30 date for MNPS. So I see that, as I said before, providing some additional flexibility in what we are able to help with MNPS. So I think that's a good thing. It starts to look and sound like if we did 25 million for the city's emergency response, we then need to look at where do we want to place the remaining of the community funding of that 4.8 million. Again, some division between small business and the rent and mortgage relief. Those are not the only requests we've had from the community. You all are aware of every request that has come through. What I think is important to consider is that there are specific, I will say, groups or alliances or specific kind of interests that have asked for funding. But what is consistent is that if you were out of work because of this pandemic, you qualify for mortgage and rent assistance, which is by far most households' largest expense. So providing the rent and mortgage relief is something to consider as being able to help the most people with their largest expense. And therefore, we're not putting more smaller funds together for individual groups or organizations. The idea of the small business grants, as you heard Councilmember Johnston say, we did the original 2 million that was depleted quickly. We allocated a new $1 million we transferred it, so to speak, from the live music venues. And within the first week, I don't have an update from this week, I apologize, but I know almost immediately half of that was applied for. So again, I think we continue to see how, with our limited funds, how can we help the most people? And I think what we've been able to do with small business and individual rent and mortgage relief is provide the greatest opportunity to the greatest number of people. Or I should say the greatest number of people with their greatest expenses. So if we can come to a conclusion of, with the 4.8, do we want, how do you want to divide that? I mean, you can do it right down the middle. You can have more or less. But I do think we have the opportunity to, again, what we're doing is we will spend the 29.8 million on public safety salaries and create this new reserve. The reserve we don't have to wait until January 1st to spend that reserve. What it does is we would spend everything that we've already allocated by CRF funds. We would make sure those were all spent before we started using this new reserve. If we run out of funds on December 15th, and we've spent all of our CRF, then we start with the reserve. So I hope that's helpful to think about kind of the pattern, what it could look like, what we would be asking council to approve, and the timing of it.
And Ms. Wiggins, we've sorry to interrupt, but Dr. Battle has joined us as well. She wanted to bring thanks to the crew, and she is about to have to jump off to another meeting. So if you wouldn't mind recognizing her.
Excellent. We'd love to have you, Dr. Battle. Thank you for joining us today. The floor is yours. Let's see. Do you have microphone access?
I think so. Can you hear me?
You are. Yep.
Okay. Excellent.
Yep.
Well, and I won't take up much of your time. Good afternoon, everyone. As you've probably heard from our team already, how just vital resources are for us right now. Hank probably expressed earlier the need for us to comprehensively run what feels like two different districts at the same time. Because as you all know, we have students both in person and virtual. But more than anything, I did want to thank the committee for your work and hard decisions. I know all of this is providing very challenging work for us all, and there seems to be no easy decision. So thank you all for just your commitment, discussions, and questions to my team and myself to help better understand the needs of our district. Ms. Wilson, I know you made the point that this is your top priority after public safety. Of course, we're not asking for more than originally allocated, just wanted to maximize every penny. And please know that any investments in MNPS, we are very grateful for and are making sure that we're investing in the right spaces to provide for and support all of our students and our employees. So just wanted to thank everyone for your time and your hard work.
Great. Thank you, Dr. Battle, for joining us. I see a couple hands, so if you have a moment, I'll call on first Councilmember Johnston and then Councilmember Gamble in case the questions are directed to you.
Mine was not directed. I was going to just ask when we're looking at the $4.8 million to divide it up between small business or individual, do we have to do that? Can we just say community needs? Because I feel like I'm hoping anyway that either small business will slow down or possibly pick up, and vice versa with individual needs that maybe lumped together to say, as those needs present themselves, that we have 4.8. I mean, it's going to go. It's just, I don't know that I feel comfortable trying to predict,
Sure.
And I don't want either one of them, especially the individual needs, as far as keeping a roof over people's heads. I don't want to allocate or earmark for that.
Yeah, I think we have the flexibility. If you don't mind, let's come back to that just in case. Councilmember Gamble, I want to see if your question is for Dr. Battle while we still have her.
Yes, thank you so much. And thank you, Dr. Battle, for joining us today, giving us this comment. We know that you have a lot going on trying to keep our students and teachers safe. And I really just wanted to commend you on the job that you're doing. In my opinion, you're really setting the model for schools, particularly in the Tennessee and in the Southeast, for how to operate during this pandemic, this 100-year pandemic. And I just wanted to applaud you and tell you that how much we appreciate the work that you're doing.
Thank you so much, Councilwoman Gamble. Greatly appreciate your support. And just know we're all in this together, trying to do what's best for our city and definitely for our kids and youth.
Thank you.
Great. Do we have any other questions for Dr. Battle while we have her? I don't see any other hands. Great. All right. Of course, you are welcome to stay, Dr. Battle, but knowing and appreciating your schedule, it looks like questions have been answered. So I appreciate you. Thank you. Okay, so let me pick back up where Councilmember Johnston had asked, do we need to actually delineate? Can we say 4.8 million? I think we have that flexibility. What I want to make sure we do is present a framework that is clear enough and for the council. So when we take this to the council, let's just talk about how it plays out. If there is 4.8 million, are you all then comfortable, if that is to say to be divided between small business and rent mortgage relief as needed? So that's, I think, how we would say that. Are you all comfortable then that in working with the nonprofits, specifically United Way and Pathway, if that is where we go, do you want them to come back to the committee to ask for that money? Do you want me to, take those requests? I think we just need to be specific in how that plays out so that I don't want to create I don't know if we want to create first come, first serve, or if we want to have it laid out with a different plan. So we certainly have the flexibility to do that. I just want to see what it looks like down the road as far as decision making. Edward Henley.
Awesome. Thanks for recognizing me, Mary Jo. I think as I'm starting to, really allow a lot of the things that were discussed this morning to sink in, I feel that, and I don't want to put words in anybody's mouth, but I think there is some concern about exactly what you were saying. What is that process as it transitions into this reserve account? And I feel like maybe some of that can be alleviated if we do take some of the steps you're saying. For me, and the reason that I particularly supported the motion that was made last week, I guess, at this time, days are running together. It was particularly for just instituting a practice that I felt we had all bought into. And I believe had felt well that there was an evaluation for specific requests and not having, in any way, form, or fashion, MNPS be excluded from making any additional requests. It seems that they already have quite a bit of information that would support additional requests. I think there may be a bit of a dividing line between committee members of whether or not they should even have to make any further requests or not. And for me, I'm not trying to devalue the safety of our students or any of the staff and workers and contractors who interact with Metro Nashville Public Schools. It's more in line with just creating and following a methodology that we had all put in place and I thought was one that was effective. And I say all that to say, I think, Mary Jo, if we're looking at kind of ways to put this framework together, I would personally like for it to be as closely modeled after what we've been doing. I've been fairly comfortable with it. I understand it has not necessarily allowed for funds to be expedited in a certain fashion. And like you said, it hasn't been first come, first serve, but I don't necessarily believe in this matter that's appropriate. I think it should be prioritized. And I think, quite honestly, the bullet points that we heard earlier, kind of what those priorities are and the way that they'll be addressed, to me, aligns well with what I think this committee's been working to put a human factor around those words in black and white. And so I just want to show my support for putting a framework together that is in some way, form, or fashion similar to what we've been doing.
Great, thank you for that. Councilmember Sepulveda.
This is Councilwoman Sepulveda. Thank you. I wanted to comment on the specific amount. I would be more comfortable if we designated a specific amount and not just a blanket, small business and rent, mortgage, and utility relief. I think the council, one thing that was suggested to us was assign everything at the end so we don't come back as a body and debate this back and forth. And I think it would be wise of us to have a specific amount for small business and relief for our residents.
Did you have any amounts in mind?
I don't. I don't. I know that our small business is they need more right now. I want to know how much is, if you could remind me how much is left in the rent, mortgage, and utility relief, and the projection for spending that by their that we gave them. I think it was December 30th.
Yes. So I did, in fact, receive a report earlier today from United Way. They typically will send it for our Thursday meeting. They are at a total, hold on one second. Roughly $7.1 million has been expended of the 7.2 million of the $10 million. And as far as disbursements to the clients, it's running roughly $1 million a week. So I think that's why when we talked about, that it would run out in, early to mid-December, that was based on kind of that, I hate to say burn rate, but the distribution rate of the currently that, we had, I'll say, kind of a slow start from their funding, but, word is out, the needs are great, and the distributions are expected to run out in early December. On the small business side, they're, like I said, this was last week, but after the council meeting where we approved the reallocation of $1 million from the live music venue to the small business fund, within that same week, $500,000 was already applied for. So I suspect that $1 million is not going to make it much past the end of this week or next. So I do think we're looking at both of those funds being depleted. I would say small business would be depleted by the end of November. And it sounds like early mid-December, the rent and mortgage and utility assistance also is part of that group. And we can continue to leave it broad like that. I don't know if some of you noticed there was a large announcement of over $16 million in grant funding from NES for their services. So that is great news. That as I don't want to discount that this fund does include utilities, but again, back to the idea of optimizing which buckets are available. It seems to be that there is some utility relief, not only through NES directly, through our own Metro Action Commission, there is utility relief. And so perhaps the rent and mortgage becomes the highest priority of what's already been funded to United Way. Okay, I think Councilmember Gamble, and I see Sarah Finley, I think in that order. Oh, and Councilmember Johnston.
Thank you, Mary Jo. Just to follow up to Ed Henley's comment, I agree that the process that we have been using has been very thoughtful and diligent and prudent in how we've made our allocation recommendations. And I think we should continue that with this last resolution that would incorporate all of the different areas that we're setting, all of the priorities that are stated in the framework. I do have a question about the resolution to, or the substitute to the resolution to decrease the funding for Metro schools. So now we're saying that we are going to, and correct me if I'm wrong, I guess what I'm hearing is that we're saying we're going to reduce that amount by 5 million and then put that 5 million in this framework for Metro schools after that will come out of the reserve after the December 30 deadline. And if that is the case, how does that change the substitute? Will that language be included in the substitute that you're working on? And I think that was initially discussed in last week, and it was stated that that wouldn't be the case. So I guess now I'm kind of wondering if we're going back to that or where we are with that as we look at how to fund the different areas. And in regards to the community support, I think the numbers that Mary Jo, that you have here, the 2.8, the 3.8 for individual, or the 2 million or 1 million for small businesses. I guess in the past, we kind of looked at proposals and looked at the impact of that. Is there any way that we can get, because I guess our resolution has to be ready by Friday in order to get on the December 1st agenda. Is there any way that maybe for our meeting on Thursday or prior to that, we can have information to know what is the impact of these two different amounts going to those two organizations, so we can make a better informed opinion, informed recommendation on that impact?
Yes, and I can probably share some of that right now. Let me pull it up real quick. The average award, let me get this. I think I know where I saw this. I think the average award for rent relief is running, it's currently at $2,200. So that is the average assistance to clients for rent, mortgage, and utility. And then the small business number, gosh, I used to have that printed, hold on. I think we had 283. Is running about 7,000, because remember that the micro businesses cap at 5,000 and the small businesses cap at 10,000. Make sure, yeah, the 283 is correct. So, with an average of 7,000, an award for a small business, and 2,200. I know the last report was at 1,900, so we can still use the 2,200 or 2,000, whichever we prefer for rent, mortgage. That we can back into how many families is that, how many small businesses is that. So if we simply split the 4.8 million and took 2,400,000, that would be 343 more small businesses and almost 1,100 families, 1,090 families. So just a little bit of a perspective kind of context.
Yeah, it's very helpful. Thank you. And then to the first question about the substitute.
Oh, yes. So currently, the way it is drafted, the substitute essentially just walks through a little bit of a progression of time where it says, kind of, whereas in June, we awarded $24 million for these two items, whereas we know that they received $10.5 million from the state to cover those similar costs. But whereas we know there were additional costs, we are now expanding the eligibility to additional items for a total of 19 million. So that is the substitute as approved. We can add a line if we know. I think because it was up in the air, I didn't know where we would end up today. But if we end up that we are going to reserve $5 million in our emergency response for MNPS, I think we would absolutely go in there and add another whereas that says, and whereas, additional contingency funding will be provided for MNPS, there it be resolved. And then we say we are awarding $19 million for, the new expanded items that this committee already agreed upon. Again, that was the digital curriculum, the at-home school supplies, teacher laptops, student hot laptops, and hotspots. So that substitute would remain intact. As a reminder, The resolution that is out there right now is the $24 million resolution that was deferred one meeting. What we would do is defer that again this evening so that this new substitute would come on the December 1st agenda. This new substitute would then come on at the same time as this proposed framework. So the council would see not only the $19 million resolution on December 1st, they would also see, I guess I'll start calling this the 29.8 million, which has this spending framework of spend now on eligible expenditures, create this reserve, and in this reserve is $25 million for city response, which includes Metro Nashville Public Schools, and however we split up the remaining community funds.
Okay.
Answer it?
Yes, thank you.
Great. Let's see, Sarah Finley.
Yes, thanks, Mary Jo. Yeah, just a couple of comments. In terms of how we allocate between, rent and utility assistance and small business assistance, if you go back to the beginning, we put $10 million toward rent and utility assistance. We had $2.2 million of pathway lending grants, and that was, subdivided with micro businesses. And then we had the 1.5 that went to technical support, which I'm not sure exactly where all of that stands, but presumably the communication plan and technical support is ongoing. And part of that communication was designed to make sure that small businesses did tap into other resources, including state programs that were available. I guess I would like to suggest for discussion that we use a similar allocation. I think the worst outcome for our community is in the winter months with lack of clarity over eviction moratoriums, is to have people not be able to be at home and stay at home because they can't pay their rent or pay their heat. And I would like to suggest an 80-20 division between rent and utility support and small business support, which is in terms of grants where we were originally, and to kind of stay thematically consistent there. I think it serves an awful lot of people. And I also know that our technical support is hopefully helping some of these businesses pivot. And also I know that there's some state programs that our technical support should be helping them access. Also point out that things are not closing down. And so hopefully businesses are starting to get some revenues, notwithstanding the frustrations we all have about the pandemic cases increasing. And then finally, I just, I can support, as I did last week with some reservations, the adjustment of the amount for MNPS at this point. But I would like to make it clear that we are designating an amount for MNPS in this special reserve fund, as opposed to just lumping it together with emergency response, so that we can assess at the time what other resources might be available to MNPS, what the facts on the ground might be. A lot could change by the time that gets, evaluated, because I know things can change quickly in the political environment that we're in. So anyway, those were my comments.
I'm wondering, sorry to jump in.
You're good. I was coming to you.
I'm wondering.
It's efficiency.
I'm wondering if it. Yeah, sorry. I'm wondering if it would make everyone feel better that, my intention for going from 20 million to $25 million, and then, having that need that we have pulled back, sort of lumped into that, to Ms. Finley's point. Would it make everyone feel better, not only just from a conscience perspective, but also an optics perspective of what we're doing, to say, okay, $20 million for Metro's emergency response, $5 million for MNPS, and then that specifically expands what they can spend money on and when. It's more flexibility on when they can spend that money. So, if we left the $5 million there and kept it to $24 million, that money would have to be spent by December 30th. by moving it into this reserve and earmarking it specifically for MNPS, we really haven't taken it away from MNPS theoretically. And then it allows them through, FY21 or whatever, date, to apply that $5 million, which obviously will be spent on MNPS needs. I mean, that it's not going to go away. So $20 million for Metro's response, $5 million for MNPS specifically, the 4.8 for community needs, however we decide. And I echo Ms. Finley's point too, is that, again, it makes my stomach hurt to think about families being evicted in December, January, February, which is our harshest weather. And that was obviously our number one priority when this committee first convened. So I would be in support of an 80-20 or a 75-25 split, however everyone feels. But back to my point, would that make everyone feel better to change our framework to specifically set aside for MNPS?
Yeah, I was actually going to ask the very same question. I don't see any hands, but I'll just echo and kind of repeat, because I think we're getting really close to our framework and resolution, which is that the 19 million stays. The $19 million substitute resolution for MNPS would stay as is. Again, just a reminder, folks, that's $19 million for student laptops, teacher laptops, hotspots, digital curriculum, and at-home school supplies. That substitute would stay as is, be presented on December 1st with this resolution, which quick math on the 80-20 split would say Metro's emergency response of 20 million, additional funding for MNPS of 5 million, rent relief for 3.8, and small business for 1 million. That gets us to our 29.8 million. It gives the framework, it provides the flexibility. And remember that what I think is a very important, inclusion into that is that any differences, any leftover funding, not just from that 29.8 that I just mentioned, but all of the previous allocations that we've made to nonprofits and the city response estimate, as well as then any adjustments that come from FEMA filings, they would, in theory, what I'll say, add to this reserve. So this reserve could actually go up if at December 28th, one of our nonprofit partners tells us they didn't spend all the funds. But any adjustments from all of the previous allocations, including this 29.8, would just continue to be plus or minuses to this reserve. And the final expenditures would end up being our infrastructure for emergency management and our health department needs that we've talked about, whether it's fleet, gear, technology, different capital needs for communications, but that we are reinvesting in this emergency infrastructure that has certainly been put to the test for the past 8 months. Councilwoman Gamble?
Thank you for that great recap of what has been discussed. I totally support the 80-20 suggestion that Ms. Finley suggested. I think that is a great example of how we were continuing to do kind of using the same metrics that we've used previously in regards to the public support. As far as the other 29 million, I'll go with the majority of the committee, but it just seems like if education is the priority that we're saying it is, then we should keep that 24 million and add something else to this framework, since it wasn't initially added in this framework. It seems like now we're reducing an amount that's already been approved in order to add it to this framework. But, and I'm not sure how the council will feel about that. That'll be interesting to see as well when we get to that point of presenting it on the floor. But, you know, like I said, I'm of the opinion that we should not reduce it. We should keep the other resolution like it is, and then add something in here for education. But if that is the will of the committee to do it the other way, then you know, then that's how it'll be. But I just want to make that comment.
Let me just follow up real quick, Councilwoman Gamble. Did you want to keep the other one at 24 million and then don't have the 5 million in this other resolution, or were you saying both?
Well, it seems like that's where the committee is going. So I'm saying that's better than just leaving them out. It seems like we're giving it back to them. We're taking it away and giving it back, which is, you know, I guess that works because it gives them more time to spend the money, even though the initial 24 that was approved, they had enough time to spend the money within the allotted time. But what I'm saying is that if we didn't do what the suggestion is, as far as adding that 5 million into this framework for the reserve, then they wouldn't have even been in the reserve, which is probably a mistake as well, considering that education is a number 2 priority. So while it seems like, or I guess the perception may be for some that we are giving them, we are making education our priority and we're returning a reduction, we're actually just removing the money that was already allocated, but not really including them as a priority in the reserve. So that's how it looks to me. I just want to make that point.
Yeah, I appreciate that clarification. Thank you. And I'm tracking with you. I think, you know, what you state is correctly. I think the one advantage that we've done by this route is actually creating the flexibility afterwards. And that's a little bit of a, I don't know if I want to say bonus, maybe that's not the right word, but it is an added feature or benefit to the $5 million shift. So it's, maybe that's the right word to say, is we have shifted the total 24 into creating some flexibility on the backside, which I do think at this point is an advantage. Let me take a quick scan. I don't want to cut anybody short. I just don't see any hands.
Could Mr. Clay speak to that? I mean, with what we're saying now is that, to Jennifer's point, we're sort of taking it away and we're putting it over here. Still the 5 million allocated for MNPS, but just giving them more flexibility. Could he speak to that? His thoughts on that, just in general.
Thank you, Councilmember Johnson and Councilmember Gamble. Hank Clay from Metro Nashville Public Schools. So we structured these expenses very carefully. What we brought for this reallocation to be expenses that could be fulfilled at December 30th deadline. And so if the committee supported these expenses, then we would prefer to go have the guarantee to be able to make predictions for how we use the money, to be able to, like, for example, if we didn't know that we were able to allocate this money as originally intended, then we're not sure if we would be able to get to school nurses. And so this certainty of being able to move forward as kind of originally this committee approved would give us more of that certainty to be able to make decisions and take action.
Thank you for that, Hank. So I officially need somebody else to make the motion as I think I've summarized it. Happy to assist, but you all are the committee, but I think we're ready for a motion.
I'll make the motion. Is that we're talking about for the framework with the 29.8?
Yes.
Okay, so I'll make a motion that the $29.8 million unallocated to be applied towards public safety and health salaries in order to create a reserve, giving us more flexibility with time, earmarking $20 million for Metro's emergency response as defined in your email, $5 million to MNPS needs, $3.8 million for individual rent mortgage, possibly utility relief. I would feel comfortable taking utilities off of that to focus more on rent, since there is other support for utilities, and then small business at $1 million.
Is there a second?
Second.
This is Alex Dickerson. One reminder for the Councilmember Johnston, do you want to this to come back before the committee, or do you want to be the volunteer to be the connecting point for the small group between me, you, and Mary Jo to get the final language?
I'm happy to be that point person, but if the committee wants it to come back to them, which that's fine too. I mean, I assume we're going to meet next Thursday as planned, or today, or in 2 weeks.
This Thursday.
This Thursday. So whatever everyone feels comfortable with, I'm happy to do either way.
Yeah, I forgot about this Thursday. Never mind. I can get you final language by Thursday.
Perfect.
Okay, so we have a motion and a proper second. Are there any more questions or discussion? If not, I'm going to take a roll.
It's Councilwoman Sepulveda. I do. I understand that NES has grants, but we also have water, and our water bills have been going up since we did raise the rate, and I think some of our constituents, for the council members, but some of our residents are having a bit of issue with their billing as is. So I would be more comfortable leaving utilities on.
Okay, I think we'll leave utilities on, and it is very, it is very simple for me to just reach out to United Way, and they can share with their partners that, and I already know they do this, but they're pretty good with finding the different pockets. So as much as we try to make it easy on those that are needing the assistance and not, sending them multiple places, I think to your point, because there's gas and, water, we can leave the utilities included, but happy to reach out to United Way and just make sure that they are pointing out to their partners where else there may be utility relief.
This is Sarah Finley. I just wanted to comment that I think the bulk of expenditures shift to gas during the winter. So I think we've got to be cautious about that for heat.
Yeah, great point. So keeping that in there seems to be the right thing to do. All right. Any other questions, comments? I will take a roll vote. Okay. All right. Sarah Finley.
Aye.
Councilmember Gamble.
Aye.
Edward Henley.
Aye.
Sean Henry. I don't see you muted. Gonna have to try again here. All right, I'm going to come back to you, Sean. Councilmember Johnston.
Aye.
Vonda McDaniel.
Aye.
Junad Udubeko.
Aye.
Councilmember Sepulveda.
Aye.
All right, Sean, we're going to try this one more time. Oop, now I see your microphone and you're muted, so that's a good sign. Are you there? All right, do text messages count? Because I have a text message from Sean. Hold on. He's saying yes. Alex, does that count if I get a text message?
Do you have enough votes to do it without the text message?
We do.
Okay, let's just say that you acknowledge the text message, but go with the votes to chat.
We'll put Sean officially on record, but our document, it is 8 in favor, 0 against. All right, and we will work on this draft. What we'll do for next Thursday, or this Thursday, sorry, is we have the MNPS substitute resolution. We'll look at that in conjunction with this resolution, so you'll see them together, and that will be what will be presented to the Metro Council on December 1st. And then we do have some regular interim biweekly reports from our nonprofit partners. Is there anything else we would need to cover on Thursday?
One thing I just wanted to put to the committee for this just really quickly, we do have a resolution that may or may not be deferred, but it is asking for $5 million in CARES Act funding to go to the Bordeaux long-term health care, along with a $1.5 million allocation from the 4% fund. And we haven't discussed it too much, but Signature has come out with a letter against slowing things down. There's only 32 patients that are remaining there. They all have insurance. Do we as a committee want to make a statement? Because I think that the council does say, well, what does the committee say? Do we want to make a statement in regard to that ask, and just kind of bullet pointing out our reasoning behind it, or do we just want to leave it alone?
Yeah, I think that's a great point. And I'm sorry, I think I just cut somebody off, but for the committee to know, we discussed it briefly last Thursday. It has come up again at Budget and Finance Committee, other committees, as well as it will at the council tonight. So for those just a little bit less familiar, the conversation last week was because the Bordeaux long-term care facility is being wound down. As Councilmember Johnston shared, there are 32 patients left. There is a resolution asking for CARES Act funds to extend the date of operations of the facility. Signature Health, these are lots of different names. Signature Health is the current provider of care, the operator of the facility, and they are recommending against extending the date of operation. The current end date is estimated at January 31st. So there is time remaining for those 32 patients to be transferred to other locations. And there are budgeted funds to wind down the facility, including severance for employees and the care. In addition, one question that came up I will share is that Signature Health is receiving CARES Act funding for the operations. So for any of the eligible expenditures from CARES Act, Signature is receiving those. So we couldn't duplicate any of those expenditures with our funds. So that's just a little bit more background of the issue that Councilmember Johnston brought up. Let's see, Councilmember Gamble.
Yes, I just want to add, Mary Jo, you can correct me if I'm wrong, that during the budget meeting yesterday, committee meeting, it was stated that they, because the funds would need to be expended by December 30, that was another issue with these particular CRF funds. They wouldn't qualify for that particular priority because they couldn't spend the funds. The funds wouldn't be spent before June 30.
Yeah, it gets complicated, like we've experienced today. It's all kind of chronology. Do we get the chronological order right? For expenditures through December 30th, there is a budget that was already passed and that we have been utilizing to pay for the operations of this facility. If there have been specific COVID-related expenses, they have been incurred by Signature Health and therefore reimbursed by the U.S. Department of Health and Human Services as part of the CARES Act. Those have been reimbursed to Signature Health. The request specifically asked for CRF funds for post 12/30. We can't do that. You know, the 12/30 is our expiration date. So any of the expenditures related to this facility after December 30th could not be covered from the CRF. As we just did, this committee did spend the final dollars in a manner that allowed funds to be used after December 30th, which we put together that structure and framework. There are still budgeted funds available post December 30th. Now, we don't know how long those funds will last. Signature estimates kind of through the end of February. And the reason it's hard to estimate is because we have those 32 patients. We certainly are going to have a different loss run in these final months as we wind down and don't have the patient volume to support the revenue. But what Signature is also saying is that because they are now at low numbers, they do not recommend and they said it for the safety and well-being of the patients, they don't recommend extending the operations past the January 31st date. They are confident they will have all patients safely transferred by that date. They have the employee severance agreements in place, and the wind down plan is going as planned. So the reason I say it gets complicated is because with the 29.8 million left to a reserve, the question was, should any of those funds be reserved for these operations? But there is already funding in the budget for the operations as planned. And it is not recommended from a patient perspective to extend that wind down plan. So I hope that addresses the question.
Thanks for the clarification.
Councilmember Sepulveda.
Thank you. This is Councilwoman Sepulveda. I would rather not kick a hornet's nest and not make a statement on it. I think we had quite a long debate last night, and we'll continue one tomorrow. I think there's some of us, not tomorrow, today. I think there was some of us who, signed on to, some council members that signed on to a letter against the wind down. And so I just would not feel comfortable having an official statement from this committee.
I would like to say I agree with that, and part of the reason is, not having access to enough information to really make a statement of any substance. That's kind of the way I feel, without the benefits of some of these other discussions and understanding what really is a COVID-related impact versus what is not.
Great, I appreciate that from hearing from a couple of you. With that, I think you have your council members that are part of this committee that, when asked, can relay that information. I believe with the agenda set for 2 days from now to review the resolutions and then we'll look at our interim reports. I believe we have covered our agenda for today. And seeing no hands, I will adjourn. Thank you so much. I think that was a big accomplishment today.
Thank you.
Appreciate y'all.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.